Hello, I'm Tunde Abati, and this is my presentation on JCAHO and JCI. In this presentation, we'll be looking at the benefits of accreditation to patients and healthcare organizations, the general differences between JCAHO and JCI, the differences in standards in both organizations, and the effects these organizations have on the US health and global health, respectively. First of all, there's a need to understand the meaning of accreditation. What does it mean for an organization to be accredited? It's simply a form of assessment performed by an external body, in this case the JCI or JCAHO, that mainly seeks to assess the credibility of any healthcare organization to see that they are up to standard or up to a position where they can deliver quality healthcare services. And there are so many benefits to this assessment, but a few of them are that it helps to promote accountability and transparency. It helps to bring about improvement and offer solutions to various problems. It gives way to better management of these organizations, and also it reveals areas that many issues are embedded and addresses these issues, and it also fosters healthy competition amongst organizations in the sense that they all try to be better than they were before, and this leads to a widespread increase in performance and general quality of healthcare delivery, which is beneficial to the patients and the public in general, regardless of the scale of operations. Looking at the JCHO, which stands for the Joint Commission on Accreditation of Healthcare Organizations. It's a non-profit private establishment that was established in 1951, and mainly it concerns itself with the operations of healthcare establishments in the United States. It is responsible for the evaluation of over 16,000 healthcare establishments in the US, which include hospitals, care entities, mental health facilities, emergency services, and so on and so forth. And it is governed by representatives from the American College of Physicians, the American College of Surgeons, the American Dental Association, the American Hospital Association, American Medical Association, and other governing bodies, and is also overseen by a president who is in charge of day-to-day running and activities. JCI, on the other hand, takes on a more international or global scale. It is known as Joint Commission International, and it's in collaboration with numerous establishments, governments, and institutions all over the world, which means that the scale of the JCI and its reach is much wider than that of the JCAHO. Now, comparing both organizations, it is easy to see that there is a big difference between both. First of all, in scale of operation and also reach. JCHO is recognized nationwide, whereas JCI is globally recognized. And this affects their focus in the sense that JCI has a wider reach and seeks to reach out to larger organizations and a larger number of establishments also than JCAHO. And looking at the standards, it is important to note that the standards do not just cut across all areas in healthcare. As we know, there are different sectors in the healthcare industry. There are different levels to it. So there are different standards set by these organizations for different areas. And an example here is in pain management and healthcare. And for JCI is the standards for operations in hospitals. The effects of both organizations on healthcare based on their aim and their mission and the reason for their establishment, they're quite similar. Is the only difference that exists in this case is the reach that both organizations have. That means the impact the JCI would have would be on global health, which would undoubtedly also affect the United States, while the JCAHO is primarily concerned with operations in the United States, which means that its efforts and effects of these efforts will be shown or more pronounced in the United States. And one thing common to both of them is that an end result is the overall improvement in the quality of healthcare delivery. Feel free to check out my references for more information on the topic. Thank you for your attention.